Hello, everyone, and welcome to our weekly update for COVID news here in Berrien County. I am joined by Nikki Britton from the Berrien County Health Department and Dr. Lauren Hamill from Spectrum Health Lakeland. So Nikki, if you just want to start by giving us a little bit of an overview of where we're at now with COVID data in the county and what we're seeing.
Yeah, I'm actually going to share a PowerPoint slide here for everyone to see. I hope. Are you seeing my slide, Jessica? Okay, so what we have here is the Epi Curve for the whole pandemic. And for those of you who've been following along, I know there's lots of you with our data dashboard, you've been watching the daily numbers. I think this graphic really helps to put into context where we are. So the blue line here shows the number of cases reported to us each day throughout the pandemic. When we look back to what was happening in May, April and May, and then again in July, we had what we were talking about as different waves. The media kept talking about, are we having a first wave? And in July, we're having a second wave. We had not even reached an average of 20 new cases per day on either of those bumps on the curve. Given the scale of the graph with the amount of cases we now have, these bumps in the spring and summer look largely flat compared to where we are now. So this graph is even a couple days old. We are now exceeding an average of 100 new cases per day in Berrien County. There has been significant uptick in the number of new cases in our county really since the beginning of October. And what we have actually seen, to put it in perspective, we've seen an 8.5-fold increase in the number of cases. So 8 times as many cases being reported per day now compared to October 2nd. We compare that to, we've seen a 5-fold increase in our percent positivity. We've seen a 3-fold increase in hospitalization rates, and we've only seen a 1.5% or a 1.5-fold increase in our testing. So we know with all of those things together, this increase is really driven by actual increases in community transmission. It is not a result of simply more testing. We have been doing more testing, and we should be doing more testing as we're having more cases available, but we are seeing significant levels of transmission, unlike what we've seen. And we have doubled our number of cases 3 times since the beginning of October. That's sort of how you get to that 8-fold difference. But it has only taken us about 10 to 12 days to double our number of cases. When we're sitting here now at an average of about 100 cases per day, and we are now officially 13 days before Thanksgiving, this graph could look dramatically different next week or by Thanksgiving, right when families are all starting to gather, if our trends don't change. So these are trends we're definitely watching. This is where we need to be applying our effort to try to flatten the curve.
And Nikki, thank you. And Dr. Hamill, what are we seeing in terms of numbers at Lakeland and people who are sick and coming to the hospital? Do we have the capacity? Where are we at?
Sure, I'll get right to that question. Nikki, this is what we've been worried about, what we've been warning about, and what we've been trying to prevent this whole time. You know, this kind of steep escalation of cases is really what puts our health at risk, our lives at risk, and it puts the capacity of healthcare at serious risk. So I really appreciate you highlighting that. We're running about just close to 50 inpatients per day at this point. When we project ahead 2 weeks, that number might get closer to 65 or a little higher. Currently, we have enough PPE, we have enough masks and gowns and hand sanitizer. The short supply is staff, because when there's community spread, that community spread occurs with staff as well. We can accommodate the current volumes, we can accommodate a little more. If we get a lot more, we're going to run out of the ability to take care of other healthcare needs. And if the infection rate continues to increase, we're going to run out of staff who are healthy and can take care of our friends and neighbors. So we just implore for folks, it matters more now than ever before It matters more now to create that social distance, to wear your mask, to sanitize. And Nikki, you've seen this in literature. We've seen this in literature. Early on, we saw spread through the nursing homes. Then we saw spread through crowded places like bars and restaurants and churches. Right now, the spread is just people expanding their social bubbles.
Yeah.
You know, their friends and neighbors coming over for dinner or game night. You know, those things are resulting in around the country, not just here, but is resulting in a lot of asymptomatic transmission. Somebody who doesn't know they're sick, give it to somebody else, and they pass it on, and it's creating the surge that we're in the middle of right now.
Yeah, and if I could maybe just say in another way to make sure that we're hitting that point home. In our community, we have people that have healthcare needs every day. We know that we have people with heart conditions. We have people with many chronic diseases. And typical days, the healthcare system is there to meet those needs. If somebody needs hospital level care, they're able to be admitted, they receive excellent care and are able to have that need met. What we're seeing, what I think I'm hearing you say with the increases in the number of COVID patients is that as we see that number increase, if my mother or my loved ones need some sort of health care for their existing chronic condition, that might be harder to come by because we also have this other demand on the system. Would you say that's accurate?
Absolutely right. It will jeopardize our care of other healthcare needs. I was on the phone this morning with representatives from most health systems, kind of in the middle of the state westward, and everybody is experiencing this. So it's not that I'm just going to be transferred to another hospital. Hospitals are on diversion. They're not accepting admissions because they're so full of COVID. And so we're not quite there yet in Berrien County, but we're rapidly approaching that. And we predict within the course of the next 2 weeks or so, either we're going to bend this curve, either we're going to flatten the curve, or we're going to be in the same situation as many others, that we will be hampered with caring for routine medical needs, other medical needs.
Yeah.
Thank you both. And one thing that we hear a lot from people is that we're just doing more testing and that's why the numbers are going up. So can you both address why that positivity rate is so important and, you know, it's so high and why that matters?
Yeah, so I actually have another graph that I can use to show what our trends have been. So when we look at our number of tests that we've done, sorry, trying to make this a little bit bigger. This graph represents the number of tests that have been done in Berrien County daily since the beginning of the pandemic. And we've definitely seen an increase, and we've definitely seen an increase since the beginning of October. But at the beginning of October, we were averaging as a county between 550, 600 cases or tests per day on average. We're now between 850 and 900 tests per day. So that's definitely growth, but that's only about 150%. So that does not explain the 8-fold difference. There's definitely more transmission. It's not that there was this level of COVID in the community and now we're just detecting it. There is actually more COVID transmission in our community.
And Nikki, I completely agree with that. And I think there's another phenomenon. There are some folks that are deciding they should be tested, but they don't want to be tested. You know, they're afraid that they're going to be sent home for 2 weeks and it's going to impact their family or their travel plans. And that's been occurring. We've noticed some around this county, and of course, it's been reported around the country. And so that test positivity probably is somewhat underreported. There are probably more positive cases by a bit of a margin than what we're actually measuring with those tests.
Yeah.
Thank you. And Dr. Himmel, can you address how this differs from what we're seeing at the hospital and how prepared we are from what we saw in the spring and just where we've come in terms of treating the disease over time?
There are a lot of differences. We have enough PPE, we have enough hand sanitizer, we have enough masks, and that makes caring for folks much easier. Our staff are trained. We're used to this. We're not noticing a lot of in-hospital transmission to our staff. It is community transmission that puts people at much greater risk. We also have therapeutics. You know, we have remdesivir and we have dexamethasone and we have convalescent plasma. We're going to receive very soon our allotment of monoclonal antibodies.
Mhm.
We have some treatments. And I think that gives folks a better chance for survival. And that's a wonderful thing. But the limiting factor, as I spoke before, is going to be staffing and then space. And we're expecting those staffing challenges very soon and space probably a week or two later. And our trend lines now, and of course we model this out statistically just every day, continuously, our trend lines now suggest some real serious challenges within the next 14 to 21 days.
And Nikki, are we looking at another just stay-at-home order or total shutdown of things, or where do you see that, headed?
So, I mean, I don't have a crystal ball, and I don't have any sort of direct line with what is happening at the state level. I do know that the Michigan Department of Health and Human Services, which we're operating under epidemic orders from MDHHS through the Public Health Code. There are epidemic orders in place. It's definitely possible that they could become more stringent. I think everybody can agree that we want to avoid there being stay-at-home orders. Part of the purpose of stay-at-home orders at the very beginning of the pandemic was to buy some time to better understand the therapeutics, to better understand what mitigation measures work in the community. So we've learned that masks are effective. We've learned that social distancing is effective. We've learned how to just conduct business a little bit differently out in the community. We've mastered some of those community mitigation measures. We also, as Dr. Hamill was speaking to, we have improved therapeutics. We've worked through some of the kinks in the PPE supply chain. It's not perfect. It's much better than where it is. So we are positioned a lot differently now than we were in the spring, so that even though our cases are much higher now than they were, we're better prepared and able to handle those. So I think with all of that in mind, a stay-at-home order is not necessarily an absolute inevitability that we need to go that direction. But on the other side of this, if we continue to see this really unrelentless spread and we're continuing to see every 2 weeks we're doubling our number of cases, we are going to run into those capacity issues in the healthcare system. And the last thing we want to do collectively is see our healthcare system, see our healthcare heroes making these decisions about how do we allocate this scarce resource of healthcare. So it's our job as the community, as the public health leaders, we're working to try to say, how can we bend the curve? How can we flatten the curve, slow this increasing rate of transmission so that we don't face that situation where we might be making decisions about who gets healthcare and who gets that scarce resource, trying to avoid it coming to that. So I know when we think about things locally in terms of what orders could potentially be put in place, there's always that consideration given to all of the ramifications and all of the impacts of having an order. Nobody wants to see businesses shut down. Nobody wants to see the economic impact from the spring repeated, because we know that has ripples along the way and has health impacts as well. There's this balance. So if we can do the things that we learned worked well in the spring and in the summer, those community mitigation measures, those individual actions, it won't need to come to some sort of really draconian extreme measure. But if we're unable to control the spread in that manner, those are things that we need to collectively be thinking about, and how close to a stay-home order or what other types of orders might be up for debate as to what could help us.
And going off of that, I think a lot of people are also asking, if we're seeing these high levels, why are the schools still open, or what are we seeing in the schools? Can you address that?
Yeah, that's a really great question. It's one that we get a lot. So we have learned a lot about transmission of COVID-19 and how that differs based on age. So there has been a large body of research that is showing that children under the age of 18, particularly those under the age of 12, are much less likely to transmit the coronavirus if they are infected. And we know that they are less likely, they really are not at any significant risk of severe complications, hospitalization, death. That is something that fortunately is not as big of a health risk, not nearly as big of a health risk to our children. So we know that when schools are open and what schools have in place is a really strict adherence to health and safety measures. When kids are in school, they're spending 7 hours a day wearing their masks, keeping a good distance between other students. It's not always possible to be 6 feet, but they're keeping a good distance from others, and they're maintaining really good hand hygiene. And they have diligence in those practices. That has led us to see COVID-19 rates amongst students and staff to be lower than what we're seeing in the community. They are lower than that background level. There have only been a handful of instances in which we've seen where it might be plausible that transmission actually happened in the school. And when that has happened, it's been when there's been a breach of protocol. And those that are positive cases amongst students or staff, it's been community acquired. It's due to exposures that happened outside of the school. What other communities are seeing, and we're seeing a little bit in Berrien amongst our students that have opted into the virtual options, is there seems to be a higher incidence of COVID amongst students that are not physically present in school, but doing virtual learning. And if you think about it, it's because there's not as much, accountability for adhering to those health and safety practices. And just to make things work, there are a lot of families that are having to shuffle for childcare so they can continue to work while the kids are not at school. Sometimes those can present riskier situations. The biggest issue, and we have seen this week that we've had some of our public school districts that have taken a pause from in-person, moved to virtual for a period of time. All of these decisions have been coming down to operational decisions, and it's about having enough staff to run the school and to provide in-person instruction. The teachers are and other staff members are just as susceptible to needing quarantine as, the healthcare providers we were talking about and other community members. And when you don't have enough teachers to teach, you can't hold school. Schools are not closing because there's transmission in the school building.
Thank you. And we did hear some promising news recently about a new vaccine and the effectiveness. Dr. Hamill, can you touch on that a little bit?
Pfizer's vaccine promises 90% plus effectiveness. Obviously, have to ramp up production to make that available. I suspect that there are going to be other manufacturers that are not far behind. There'll be multiple manufacturers over time of vaccine. Obviously, it's not going to be available to everybody all at once. That's something that's going to roll out over a number of months, and it'll take a little while to have peak effectiveness. So, it's really important. We can remain excited about that vaccine, but we have to remain diligent for the next 2 or 3 or 4 months before that vaccine becomes widely available to our community.
Wholeheartedly agree.
Thank you. And I think a lot of people are wondering this time of the year about flu season and, what are we going to see this year? And is it a concern? Do you both want to just address that?
You want that, Nikki? You want me to take that?
Sure.
Nikki?
Well, given that influenza and COVID are both respiratory viruses, a lot of the things that we're doing in terms of masking, distancing, and hand hygiene, those will be effective in reducing the transmission of flu as well. And there's some observation of the Southern Hemisphere, which has their flu season in the summer. There was less influenza activity, likely because of these measures in place. We can't count on that, and it remains really important that everyone continues to get their influenza vaccination. It's not too late to get your flu vaccine. It's a great time to do so, especially as we continue to move into November. But we want to make sure that we're not taking up hospital beds with influenza complications, as happens every single year. So that's a really important way to not put a strain on the healthcare system.
Mm-hmm.
you. And then also this time of the year, we're getting ready to go into Thanksgiving and the holidays. And you both mentioned earlier that that spread is really coming from close groups. Do you just want to address what we should be adhering to this time of the year?
Well, I can't tell you what to do. Nikki probably will be more directive on this, but I can tell you what I'm doing. I have 15 family members that normally spend Thanksgiving with me. They're not going to this year. You know, sure, that's a sacrifice. You know, it may break your heart not to be with your family member over holidays. But boy, I think we have to do the right thing for our community. It's my little way of saying I'm committed to do what I'm asking others to consider. Anytime you can limit your social bubble to just your family, you should. And anytime you broaden that to friends and family outside of that small social bubble, it's an extra risk. You just say, please be careful. Please use maximum, judgment. And if you do get together, you know, the hand hygiene, the masking, the distancing is still important, even if you're in your home with somebody that's not normally part of that social bubble. Did I get that mostly right, Nikki?
Yes, I mean, I think that you are following our recommendations to spend Thanksgiving with your household members and to somehow innovatively and virtually engage members of your family that you don't live with. That is our recommendation. To your point, we know not everybody is going to follow that recommendation. So if you do choose to have Thanksgiving gatherings with people not part of your household, yes, that masking, that distancing, the hand hygiene inside homes is very important. So please bear that in mind. This is an unusual year. We know that, we've lived through that, but we've made it through 8 months of this. And with the news of the vaccine, we're hopeful that by next Thanksgiving, this will be a memory. I know in my family, we're trying to play the long game here and trying to make sure that the vulnerable members of our family are with us next Thanksgiving and the one after that. And we're going to do what we can to minimize that risk and not gather in the ways that we traditionally do.
We have a couple of questions that are coming in from viewers. One is about contact tracing at the health department. And can you give us an update, Nikki, on that and just the personal accountability that we need people to take?
Yeah, that's great. So as we saw at the beginning of this video, that we're seeing upwards of 100 new cases per day. Our team is really unable to keep up with the case investigation and the contact tracing at the level that we had done before. And really, when you're at this level of community spread, it does become much more effective in case investigation and contact tracing to really focus on those highest risk and highest stakes individuals and contacts. So at this point in a pandemic, there is a shift, and this is happening throughout the state. There's a bit of a shift towards making sure that all positive cases know that they are positive, but it won't be a lengthy interview with every single case. There's a prioritization there. And not everybody will receive a call from the health department that first 24 hours that their results come back. So we're working to make sure that our timeliness is where it should be. That's one of the most important things. But what we're really asking for assistance with is that if you have received a positive test result, that you isolate yourself for 10 days following your symptom onset. You can come out of isolation when 10 days since you first had symptoms, and you have had some resolution, some improvement in those symptoms, specifically 24 hours fever-free. So that's when you can come out of isolation. Isolation means staying home and avoiding contact with other people, including your household members to the extent possible. Anybody who's been near somebody who's COVID positive and has been a close contact with them, been within 6 feet for 15 minutes throughout the course of a day, those individuals are being asked to quarantine. It is we are not going to be able to notify every single person who has been in contact with a close contact. We're asking positive cases to do that notification. If people have questions or are not sure what to do, they can always call our hotline, which is 1-800-815-5000. 5485. But if you've been exposed, you do need to do a 14-day quarantine, 14 days from the last time you were exposed. If you get a test during your quarantine and it's negative, you will continue to quarantine until 14 days has passed. Unfortunately, a negative test result does not get you out. You do need to complete that quarantine because it's still possible that the virus is still building in your body. It's not yet detected, but you may have still been infected.
And then one final question about testing. Dr. Hamill, can you address the prioritization of rapid tests and really our status on that?
Yeah, certainly. There are more tests available across the county, and we appreciate that. And you've probably noticed that you get more rapid turnaround times. On the other hand, with this kind of rapid increase in cases, we have to make sure the ones that turn around the fastest they're linked to clinical care. When somebody is being admitted to the hospital with a stroke, we need to know whether they're COVID positive. We need to know that before we place them in a unit. We can't be doing rapid tests so somebody can make a vacation trip to Hawaii, and folks will often come in and say, I really want to know. I've just been exposed to somebody and I really want to know if I have COVID. There's just not enough of those rapid tests to go around for all of those circumstances. They're reserved mostly for cases where there's a clinical relevance to the results.
Thank you. And that was all the questions that we had. Was there any final messages that you want to share with our viewers?
I certainly would like to wish everybody just a really happy holiday season here, starting with our Thanksgiving. We want you to stay healthy. We want you to stay happy. And we know that's hard when we're experiencing COVID. Look for ways to share love around your family. Look for ways to get connected virtually. Look for ways that are meaningful where you can come together with a family in a safe way at a distance. We certainly appreciate that, and it's going to help keep your family healthier and hopefully help us all save lives in our community.
Yeah. And I would just encourage people to remember what's at stake here. We want to, some of our response goals as a health department include doing whatever we can to assure that our healthcare system does not become so overwhelmed that we're making choices or resorting to crisis standards of care. So that's really high stakes. We also want to do what we can to make sure schools can stay open, because that's very high stakes for children, for families that want and need that in-person option. We know that is a great place for kids to be. Remember the stakes as you're thinking about some of your actions, and really scale back what you're doing, limit your number of contacts, and really focus maybe on going deep with a few people as opposed to having a really broad social reach right now.
All right, thank you both so much, and thanks for everyone for tuning in today.